Well. Geert has just completely eviscerated the FDA commissioner, Marty McCary, and I'm going to be sharing with you some of the thoughts that Geert had and give you some clips of the interview that he had. This is interesting stuff, and let's see if we can make sense of what is going on. Because the reality is that we are in a very complex situation. This is, in fact, the worst outcome that anybody could have hoped or wanted. Well, not hoped, because what you have got is a situation where populations are highly immune primed through vaccination, and there is continued high circulation of mutant variants going on all the time. That is a nightmare, especially when you put on the back of this that the virus, in combination with everything else, seems to trigger autoimmune responses. Goodness gracious. I really don't envy anyone who is trying to sort this out. But let's look at what Geert had to say and see why he was so annoyed. So this is from his page, Voice for Science and Solidarity, and the link is in the description. Just when you thought it couldn't get any worse. That's how he starts it. And this is the interview I'll be playing some clips of, and I'll interrupt it just to add some thoughts. And there you have it. Another incompetent weasel at the helm of the FDA. Goodness gracious. And he was upset because he was stating that SARS-CoV-2 has now become seasonal and there is cross immunity between JN1 and NB181. That's the new variant. And he is very upset that they are playing around with SARS-CoV-2 and thinking that it's just another tame common cold virus. I completely agree with Geert here on this. I think that people just keep underestimating this beast. And he went on to highlight the point. Don't get me even started on the mind-blowing, reckless decision to only pull the COVID-19 shots for healthy kids and pregnant women, but somehow still not have the guts to ban these useless vaccines outright for everyone else. Goodness, he did not hold back on what he thought. This is important, and this is a very, very tough situation because they are trying to please everybody. And I don't think there's any way to please anybody. You just have to stick with the science. And if you follow the science, hopefully you will make sense of what is going on. So what I'm joined now is I'm going to share with you a few of the clips from this presentation that was on YouTube, and I'll pause it as we go along to share you some thoughts and the nightmare situation that they are having to face at the moment. So let's hear what they had to say. We're joined now by FDA Commissioner Dr. Marty McCary. Good morning.
Good morning.
Good to have you here in person.
Good to be here.
So I want to get through a lot here, but one of the things we've noticed is this new COVID variant that seems to be circulating in Asia. I believe it's NB 1.8.1. It's a variant under monitoring. What do we need to know?
Yeah, so this appears to be a subvariant of JN1, which has been the dominant strain. So it's believed that there is cross-immunity protection. The COVID virus is going to continue to mutate, and it's behaving like a common cold virus. It's now going to become the fifth coronavirus that's seasonal, that causes about 25% of the cases of the common cold.
Let's just pause here for a second. Goodness gracious. If whatever you do not call this virus a common cold. This is, we have never seen a virus do anything like this, and it is certainly not behaving like a common cold. But here's the problem. In order to justify pulling back on everything, you have to say either everybody is perfectly immune now because they've been vaccinated or they've had infection, or the virus is no big thing. And if the virus is no big thing, why are you still monitoring it? We don't monitor the common cold. You know, what's the big deal? And if it isn't a big deal, why are you vaccinating against it? There is a disconnect. And that disconnect is confusing people. Either it's serious or it's not. And if it is serious, how do you ignore it? That's where we're having the problem. Let's get back to a little bit more of what they had to say.
So you're thinking of it as like a flu type variant, just a normal fluctuation.
The flu mutates about 34 times more frequently than COVID. The COVID variant mutation rate appears to be a little more stable, but the international bodies that have provided some guidance on which strain to target have suggested that either JN1 or any of these subvariants would be reasonable strains to target.
So you don't seem overly concerned about that. I want to get now into some of the recommendations that have been very specific this week from the CDC and you with the HHS secretary in this video announcement on Tuesday, where Secretary Kennedy said the CDC was removing the COVID vaccine for healthy children and healthy pregnant women from its recommended immunization schedule. He then had a memo to the CDC rescinding recommendations for kids' vaccines, saying the known risks do not outweigh the benefits. Then late Thursday, the CDC said, quote, shared clinical decision making, which I think is just talking to your doctor,
yes,
should determine whether kids get vaccinated. Can you clearly state what the policy is? Because this is confusing.
Yeah, we
pause it here again. And as you can see, one of the issues that came up in the pandemic, and you have to take yourself back in time and try and remember what was happening. There was no consideration in early 2021 to vaccinate children because we knew who was high risk. And I remember even in the UK, when that suggestion was put forward by the health secretary at the time, it was almost considered ridiculous. You wouldn't vaccinate children at that point unless you had lots of studies and you showed there was clear benefit, because they genuinely weren't really getting sick. Now, there were a few children who did have some complications, but the numbers were so small that parents were not worried. So if you want anything to use as a gauge in early 2021, just remember that parents were taking the vaccines before giving it to their kids. Do you think they would have done that if they really thought the kids were a problem or at risk? No, they wouldn't. Here is where they got the message confused, because they kept on being told that the risks were so small that it was almost negligible. So theoretically, if that's the case, why wouldn't you just give them a jab? Doesn't matter. It's like popping a pill, just or taking some water. It's just as simple. It does no harm. There are no risks. It doesn't matter. Just do it. And that's where people got caught. And now they're trying to see if they can extricate themselves from that very strange thinking, because it scientifically didn't quite add up. But then they had to kind of massage numbers in order to make it fit. And you'll hear that come out in this discussion. Let's listen to a bit more.
We believe the recommendation should be with the patient and their doctor. So we're going to get away from these blanket recommendations in healthy young Americans, because we don't want to see, on the COVID vaccine schedule, we don't want to see kids kicked out of school because a 12-year-old girl is not getting her 5th COVID booster shot. We don't see the data there to support a young, healthy child getting a repeat infinite annual COVID vaccine. There's a theory that we should sort of blindly approve the new COVID boosters in young, healthy kids every year in perpetuity, and a young girl born today should get 80 COVID mRNA shots or other COVID shots in her average lifespan. We're saying that's a theory, and we'd like to check in and get some randomized controlled data. It's been about 4 years since the original randomized trials. So we'd like an evidence-based approach. Dr. Prasad and I published this in the New England Journal of Medicine last week, and we're basically saying we'd like to bring some confidence back to the public around this repeat booster strategy theory, because...
Pause here again, because there's a simple point that I can't understand, that people don't understand. At this stage, every single person in the world, doesn't matter if you had symptoms, has been exposed to this virus. And so if you haven't had any symptoms, it's meant that you had good natural immunity. And so therefore you weren't going to get infected again, because this virus, once your immune system has clued into it, your mucosal immune system, that's in the upper airways, it just has no other tricks. It can't break through. The primary strategy is interferon suppression, hiding from the immune system. It has broad immunity in your mucosa, and you don't have any other complicating factors like immune suppression or interferon autoantibodies. The immunity is fine. And we can see in countries like Haiti, which I've highlighted, 2.7% vaccination rate, they're fine. There's no longer any COVID. It doesn't circulate because it can't. What we have here is also the hybrid immunity, where some people have natural immunity and vaccine-induced immunity with probably too much focus on the spike protein. And in those situations, you're having ongoing circulation of the virus. The theory is that somehow by continuing to focus the spike protein even more on every variant, suddenly you're going to resolve the problem. That's where Geert was saying makes absolutely no sense. Definitely have to agree with him there, but let's hear some more.
Your statement was not about repeat boosters. It says the vaccine is not recommended for pregnant women. The vaccine is not recommended for healthy children. That's different than annual boosters.
Yeah, at this point, we're dealing, it is a booster strategy. People would be getting the updated shot. So whether or not a young, healthy
kids who haven't gotten
so we'd like to see the data. We'd love to see that, that data
but on a
doesn't
practical
exist.
level, for a parent at home hearing you and trying to make sense.
We're saying take it back to your doctor.
If their child has not been vaccinated, are you recommending that their first encounter with COVID be an actual infection?
We're not going to push the COVID shot.
I have to pause it there. That's where you just say everybody has been exposed. This is not a first encounter with the virus. They have already been exposed to it. You don't have to worry about them having a first exposure. It has already happened. So you don't go around the question. Everybody has been exposed. You either have natural immunity or hybrid immunity. Your only question is, in that situation, who requires boosting? This is what they're trying to figure out, and this is what Geert says makes no sense. Why are you still boosting? So if somebody already had natural immunity and they weren't, say, immune suppressed, why would it even be a consideration? That's what you're supposed to say, straight to the point. You don't need to talk around it. Let's listen to some more.
Shot in young, healthy kids without any clinical trial data supporting it. That is a decision between a parent and their doctor. And just so, I don't know if you know these statistics, but for 88% of American kids, their parents have said no to the COVID shot last season. So the vast majority of Americans are saying no. Maybe they want to see some clinical data as well. Maybe they have concerns about the safety.
I don't want to crowdsource my health guidance. I want a clear thing, right? You don't go with popularity. You go with, as you're saying, data. And when we look
so
at
let's see
that
the data.
Okay, so the CDC data said 41% of children aged 6 months to 17 years hospitalized with COVID between 2022 and 2024 did not have a known underlying condition. In other words, they looked healthy. And COVID was serious for them.
So first of all, we know the CDC data is contaminated with a lot of false positives from incidental positive COVID tests with routine testing of every kid that walks in the hospital. When I go to the ICU, when I walk to we know that data historically under the Biden administration did not distinguish being sick from COVID or an incidental positive COVID test. When you go to an ICU in America and you ask how many people are in the ICU that are healthy, that are sick with COVID, the answer I get again and again is we haven't seen that in a year or years. And so the worst thing you can do in public health is to put out an absolute universal recommendation in young, healthy kids. And the vast majority of Americans are saying, no, we want to see some data. And you say, forget about the data, just get it anyway.
Okay, so on data and transparency.
So we paused there, and that's an important point, and one that has caused a lot of confusion. And this is what I don't like, when statistics are manipulated to give a narrative. And he made the point, which is quite correct. And Greece did the same numbers and found almost 45% or more of the cases that were labeled as COVID were not actually COVID cases. They just happened to be COVID positive. And in the same way, the point he was making is that the numbers that they were talking about for children who were unvaccinated with COVID, they were admitted potentially for something else and were found to be COVID positive, not necessarily severe COVID. And it's that kind of manipulation of data that is destroying the trust of the public from health and research. Really needs to be fixed. So at least he's trying to address some of those concerns. But the problem is that these are not easy questions to be able to challenge when people are talking about evidence-based medicine. You're in a pandemic, and you have to be able to pivot into what is logical, not necessarily just what is in a peer-reviewed paper. That takes years to do. And what we've been doing is just playing that evidence-based game and forgetting obvious stuff that you can look at and see, this is a problem, this doesn't make sense, why are we doing it? Let's listen to a little bit more.
For decades, since 1964, it was the Advisory Committee on Immunization Practices, ACIP, that went through this panel recommendation. I mean, people watched these things during COVID. The report was then handed up. It offered debate, it offered transparency, and it offered data points that people could refer back to. Why did you bypass all of this and just come down with a decision before the panel could meet and make that data?
That panel has been a kangaroo court where they just rubber stamp every single vaccine put in front of them. If you look at the minutes of the report from, they even say we were generally want to move towards a risk stratified approach.
So why not let them do that in June?
So in the meantime, we don't want an absolute recommendation for healthy kids to get it. They can do it, and that committee will meet and make recommendations. But you look at the minutes of the last couple of years, they say we want a simple message for everybody just so they can understand it. It was not a data-based conversation. It was a conversation based on marketing and ease. And I've written an article titled "Why the People Don't Trust the CDC," and it's in part from that blanket strategy.
You're kind of telling them not to right now. You just said don't trust the CDC.
We're saying it's going to be between a doctor and a patient until that committee meets or more experts weigh in, or we.
Just pausing you here, and this is something you can watch on your own. So I just want to give you some points here now. Very clearly, there seems to be a pivot towards doctors doing the recommendations. This is a problem, and I don't know if doctors are aware of this, because what is happening is that there is a natural shift to responsibility falling on doctors, when largely the decisions have been made by bureaucrats, politicians, and expert scientists. Now that the stuff is really complicated and nobody quite knows what to do, suddenly they're expecting the doctor to give advice. And the problem here is that if the doctor makes the wrong advice, he is then, or she is then, liable. This is a nightmare. This is the worst outcome that anybody could hope for. As I said, when you reflect on the complexity of where we are, and I have been following this and researching this for years. This is over 5 years of research. And each person is quite individual. Because what you may say to someone who has leukemia, who is immune suppressed, who is in an environment where there's lots of COVID circulating around, if you understand the mechanism as to how the vaccine works with IgG4, the immune suppression that occurs, you may choose to vaccinate that person simply because there aren't any other options. Because what they're doing is they're pulling vaccines off the table, but they're not replacing it with anything else. That's part of the problem. Nobody is able to say the truth. And the truth is that many of the things that were absolutely pillaged in the early part of the pandemic as being ridiculous and considered to be animal paste are probably extremely valuable now. But the public won't use it because it has already been completely decimated in their mind as being ridiculous. And so therefore, they have no options. That is the worst situation we could have, where in effect, we can argue about the side effects of the vaccines, But for many people, this may be the only therapy that they're going to take. It's either this or nothing. What do you do in that situation as the doctor? Even if you know all of the issues around, do you give them nothing? This is terrible. There is no easy way to solve this. And I understand as well with what Geert was saying, and I think we have to reflect carefully on it, because as he said here, is that don't get me started on his mind-blowing, reckless decision to only pull the COVID shots for healthy kids and pregnant women, but somehow still not have the guts to ban these useless vaccines outright for everyone else. He says that that compromise alone should disqualify him from any role involving public health. And he goes on to say these vaccines are neither safe nor effective and only accelerate immune escape and immune dysfunction in COVID-19 vaccinated populations. Now, I thought that somebody asked me this question as I tried to find some kind of balanced answer. And I realized when they asked that question, and this is the point that Geert was making as well. If you have a situation where the vaccines are accelerating the mutants and accelerating the risk of a breakthrough virus that can do even more damage to the population, is that worth it when the benefits are now almost too small to quantify? And we have other risks, IgG4, immune suppression, the issues about myocarditis, the inflammation with the blood vessels. There are all kinds of things that are going on in the background. And so this is why I don't envy the new leadership, because this is complex. This is not easy. And I can only wish them the best. But for you, as you are listening, just understand something. There are options out there that you can use. And if you're listening, it's a pretty good chance that you know what I'm talking about. This is vitamin D. Please, whatever you do, make sure you protect yourself with that. It doesn't have to be all the eggs in one basket, but that's what you've been given. And sadly, so far, nobody has been brave enough to try and give you any more options. As I said, this is a nightmare scenario. I don't know how we're going to get out of it, but I don't know if we have the leadership to do it either. Until next time, have a good evening.